The patient sitting across from me appears anxious, her medical records indicating repeated visits with complaints of dizziness and fatigue. Her blood pressure reading today shows 90/60, numbers that have prompted her primary care physician to refer her to me for further evaluation. Low blood pressure, or hypotension as we call it in medical terminology, represents one of those curious conditions that exists in a gray zone of medicine. Sometimes patient sitting across from me and at other anxious, times signaling her medical serious records underlying indicating pathology. repeated visits. My task today is to help her understand what these numbers mean for her specifically and whether intervention is necessary. I begin our conversation by explaining that blood pressure represents the force of blood pushing against arterial walls as the heart pumps. The first number, systolic pressure, reflects the pressure when the heart contracts and pushes blood out. The second number, diastolic pressure, measures the pressure when the heart relaxes between beats. Most people are familiar with high blood pressure as a health threat, but low blood pressure generates confusion precisely because it lacks the clear-cut danger signals and universal treatment guidelines associated with hypertension. Generally speaking, blood pressure below 90/60 is considered low, though these thresholds are somewhat arbitrary. What matters more than the absolute numbers is whether the low pressure causes symptoms and whether it indicates an underlying problem. Many perfectly healthy people, particularly young women, athletes, and individuals who maintain excellent physical fitness, naturally have blood pressure readings that would be considered low by standard definitions, yet experience no symptoms whatsoever. For these individuals, low blood pressure is not merely harmless, but may actually be protective, associated with reduced cardiovascular disease risk and potentially greater longevity. However, when low blood pressure causes symptoms, we must take it seriously. Individuals who maintain excellent physical fitness manifestations naturally have blood pressure readings that would be considered low by standard definitions. Dizziness or lightheadedness, especially when standing up quickly, represents the most common complaint. This orthostatic hypotension occurs when blood pressure drops suddenly upon standing, temporarily reducing blood flow to the brain before compensatory mechanisms can adjust. Fainting or near-fainting episodes, medically termed syncope or pre-syncope, can result from more severe or prolonged drops in blood pressure. Fatigue and weakness reflect insufficient oxygen and nutrient delivery to muscles and organs. Dizziness or lightheadedness, especially when standing up quickly, nausea sometimes accompanies these symptoms. In more severe cases, confusion or difficulty concentrating signals inadequate cerebral perfusion. Cold, clammy, pale skin may indicate shock, a medical emergency requiring immediate intervention. I ask my patient detailed questions about when her symptoms occur, their severity, and what activities or circumstances seem to trigger them. Does she feel worse in the morning upon first rising? Does standing for prolonged periods cause problems? Have hot showers or warm environments worsened her symptoms? Does she feel better when lying down? These details help me understand the pattern and severity of her condition. The causes of low blood pressure are diverse, ranging from benign to life-threatening. Dehydration represents one of the most common and easily correctable causes. When fluid volume in the bloodstream decreases, blood pressure naturally falls. This can result from inadequate fluid intake, excessive sweating, vomiting, diarrhea, or overuse of diuretic medications. Medications themselves frequently cause low blood pressure as a side effect. Blood pressure medications, obviously, can lower pressure excessively if doses are too high. However, many other medications also affect blood pressure, including certain antidepressants, drugs for Parkinson's disease, erectile dysfunction medications, and even some over-the-counter medications. Heart problems can manifest as low blood pressure. Extremely low heart rates, called bradycardia, may pump insufficient blood to maintain adequate pressure. Heart valve problems affect the heart's pumping efficiency. Heart failure, paradoxically, can present with low blood pressure despite fluid retention elsewhere in the body. Heart attacks, though more commonly associated with various blood pressure patterns, can cause pressure to drop dangerously. Endocrine disorders affecting hormone-producing glands sometimes cause chronic low blood pressure. Addison disease, where the adrenal glands fail to produce adequate cortisol and aldosterone, classically presents with low blood pressure along with fatigue, weight loss, and darkening skin. Hypothyroidism, paradoxically, thyroid, can present with low blood pressure. Low blood sugar, or hypoglycemia, particularly in people with diabetes taking insulin or certain oral medications, can cause blood pressure to drop along with other symptoms. Blood loss, whether obvious from external bleeding or hidden internal bleeding, reduces blood volume and pressure. Severe allergic reactions, called anaphylaxis, can cause blood pressure to plummet within minutes, constituting a medical emergency. Sepsis, low blood sugar, overwhelming hypoglycemia, causing systemic particularly in people with diabetes taking insulin or certain oral medications, can cause blood pressure. Nutritional deficiencies, particularly lack of vitamin B12 or folate affecting red blood cell production, can contribute to anemia and low blood pressure. For my patient, I explain that we need to investigate potential underlying causes through a systematic evaluation. Blood tests will assess for anemia, thyroid function, adrenal function, blood sugar levels, and electrolyte balance. An electrocardiogram will examine her heart's electrical activity, checking for rhythm abnormalities or other cardiac issues. Depending on these initial results, we may proceed to additional testing, including echocardiography to visualize heart structure and function, a tilt table test to formally assess orthostatic blood pressure changes, or continuous blood pressure monitoring to understand patterns throughout the day. While we await test results, I discuss immediate management strategies that often help, regardless of the underlying cause. Increasing fluid intake represents the simplest intervention. I recommend she aim for 8 to 10 glasses of water daily, more if she exercises or the weather is hot. Salt intake, contrary to advice given to people with high blood pressure, should be adequate or even slightly increased for those with symptomatic low pressure, assuming no kidney problems or other contraindications. Adding a bit more salt to meals or consuming naturally salty foods like olives, pickles, or broths can help retain fluid and increase blood volume. Compression stockings, though not glamorous, effectively reduce blood pooling in the legs and improve blood return to the heart and brain. These elastic stockings apply graduated pressure, tightest at the ankle and gradually looser toward the thigh. They are particularly helpful for people who must stand for extended periods. I recommend she obtain medical-grade compression stockings rather than regular support hose, as the compression level and gradient matter for therapeutic effect. Positional changes require attention and care. Rising slowly from lying or sitting positions gives the cardiovascular system time to adjust. These elastic stockings apply graduated
when getting
pressure,
out of bed,
tightest
first
at the
sit on
ankle
the edge
and
for a
gradually
minute,
looser
then
toward the
stand
thigh.
slowly.
Similarly, when standing from a chair, pause briefly before walking. Crossing legs while sitting and tensing leg muscles before standing can help prevent blood from pooling in the lower extremities. Dietary modifications beyond salt and fluids may help. Small, frequent meals prevent the postprandial hypotension that some people experience after eating, where blood diverts to the digestive system, causing pressure to drop elsewhere. Avoiding alcohol is important, as it dilates blood vessels and lowers blood pressure. Caffeine, interestingly, can provide temporary blood pressure elevation, though I caution against excessive consumption. Ensuring adequate carbohydrate intake prevents blood sugar drops that can contribute to hypotension. Physical countermeasures, movements that increase blood pressure through muscle contraction, can abort or prevent symptoms. Crossing and tensing the legs, contracting the abdominal muscles, clenching fists, or tensing the arm muscles all temporarily raise blood pressure. These maneuvers are particularly useful when she feels symptoms beginning. Environmental modifications matter as well. Hot environments cause blood vessel dilation and pressure drops, so avoiding prolonged hot showers, saunas, or overheated rooms is wise. Elevating the head of the bed by 4 to 6 inches, using blocks under the bed frame legs rather than just pillows, can reduce morning orthostatic hypotension by preventing excessive fluid shifts during sleep. If environmental modifications matter as well, and no correctable underlying blood vessel dilation and pressure medication drops, options exist. So avoiding prolonged hot fludrocortisone, a synthetic steroid that promotes sodium retention and fluid retention, effectively raises blood pressure in many patients. Midodrine causes blood vessel constriction, directly raising pressure, and is particularly helpful for orthostatic hypotension. Pyridostigmine enhances nerve signal transmission and can improve blood pressure regulation. Fludrocortisone, a newer synthetic steroid that promotes sodium retention and fluid retention, raising blood effectively pressure. Raises. However, I emphasize that medication represents a last resort after maximizing non-pharmacological approaches and addressing any underlying causes. I address her specific concerns about long-term implications. If we identify and treat an underlying cause, the prognosis is generally excellent. Even without an identifiable cause, if symptoms remain mild and respond to conservative measures, low blood pressure need not significantly impact her quality of life or longevity. However, if left unmanaged, symptomatic hypotension carries real risks. Falls from dizziness or fainting can cause serious injuries, particularly head trauma or fractures. Chronic inadequate blood flow to organs may impair their function over time. The fatigue and cognitive effects can substantially diminish quality of life, affecting work performance, relationships, and daily activities. I want her to understand when low blood pressure constitutes an emergency, requiring immediate medical attention. If she experiences chest pain, severe shortness of breath, severe headache, vision changes beyond mild blurring, confusion or altered mental status, loss of consciousness, black or bloody stools suggesting internal bleeding, or if her symptoms dramatically worsen, she must seek emergency care immediately. These signs could indicate heart attack, stroke, internal bleeding, or other life-threatening conditions. As our consultation concludes, I provide her with a blood pressure log and instruct her to measure and record her blood pressure at different times of day and in different positions, lying, sitting, and standing. These measurements, combined with notes about symptoms, will provide valuable information when we review her test results. I emphasize that managing low blood pressure often requires patience and persistence, trying different interventions and adjusting approaches based on response. I reassure her that most people with symptomatic low blood pressure can achieve substantial improvement with appropriate evaluation, treatment of underlying causes when present, and implementation of the conservative measures we have discussed. While the condition requires attention and management, it need not prevent her from living a full, active life. We schedule a follow-up appointment to review her test results and adjust the management plan as needed. And I encourage her to contact my office if symptoms worsen or new concerning symptoms develop before our next meeting. Low blood pressure, I reflect after she leaves, exemplifies the complexity of medicine. Unlike hypertension with its clear risks and treatment algorithms, hypotension demands individualized assessment and nuanced management. The same blood pressure reading may be perfectly healthy for one person and problematic for another. Success lies not in achieving arbitrary numerical targets, but in optimizing each patient's symptoms, function, and quality of life, while identifying and addressing any underlying pathology. This patient-centered approach, focusing on the person rather than just the numbers, represents medicine at its best.